brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Infertility is the topic. Dr. Jitka Lom is our physician in residence, and we are discussing this topic now. Dr. Lom, I'm curious, do insurance companies cover various functions of infertility, or will they provide for that?
Typically not. Typically it's considered a self-pay service. Mm-hmm. Yeah.
And it
can get very expensive.
Okay.
Yeah. If to my knowledge, it's not covered.
Mm-hmm. Because it's considered like an elective procedure in most cases, or like it's not a life-threatening.
I'm not sure of the actual definition of why it's not covered, but typically that's an exclusion.
Okay, but typically no, I guess would be the short answer. Is infertility a hereditary condition?
Well, it's like this. In some families, there may be a genetic problem where for example, the boys are born with difficulties producing sperm. That's one possibility, or actually with producing no sperm. That's a maybe congenital problem where you're born that way, you just don't make any. Or it's the same with women. You can look like a woman from the outside, but your genetics on the inside do not allow you to produce eggs or become fertile. So that is something that gets checked out through a chromosome test when you first go through infertility testing. And chromosome testing is part of the blood testing that they would do. Okay.
Well, you were mentioning in the last block before we went to commercial break that there's a 15% window, you called it, of being most fertile?
Oh, no, I meant like if a couple is having intercourse every month and they're both healthy people, typically they have about a 15% chance per month of getting pregnant. Yeah.
Okay.
So the best time, then people say, well, what's the best time of the month to try?
Yeah, that's my question. Like, is there a peak, or aside from a woman knowing that she's ovulating and everything, how do you know when you're most fertile?
Well, the best way to go about this is to actually go to the pharmacy and buy an ovulation kit, which will tell you exactly. It's there's the thermometer measurement. You check your temperature, and when your temperature goes up, that's when you're ovulating. But that's cumbersome. So really, this is a really simple test. It's a urine test. You basically dip the urine and it tells you, yep, you're ovulating, and that's the time to try. So you can buy one of those in the pharmacy, right in where the pregnancy tests are. But the other way to do it is to basically count from the first day of the cycle, that's the first day of bleeding, and count to about day 9 or 10, and that's when you should start. And then, through the next week or so is your most fertile time if you have a regular cycle, which a lot of women don't. They have a completely irregular cycle, and there's just no way for them to know when they're ovulating. In fact, a lot of the time they're not ovulating at all. And then this is something that comes with obesity, that's something that comes with sometimes diabetes, all different health conditions, and so it's something that we help them with.
Now, how about for men? How do we know when we are at our peak fertility? Like, is there a way where we can determine like how our sperm count stacks up to what should be the optimal level? Or?
Well, actually,
I'm assuming there's not a kit available for that over the counter.
No, but yours doesn't really change throughout the month. Yours is pretty much, you hit age 18 or so and you're good for a long time until you're in your 50s, and it starts dropping off a little bit at that time. But, lots of men have second families and so on right up until they're in their 70s even.
And we have certainly seen a lot of that on Guam. All right, well, thank you so much, Doctor.
Thank you.
We appreciate it.
Pleasure.
As always.
Thank you.
All right, please stay tuned. We're back after this.
Your community calendar is brought to you by Taco Bell. Whether it's your first meal or your fourth meal, we've got you covered. Taco Bell, live Más.